Okay. Regulatory compliance and information technology related theory concepts only. Okay. Yesterday up to edits we discussed, correct? This concept MUE edits, NCCI edits, NCD, LCD, all these edits we discussed, right?
Yes.
Yes.
Yeah. Today we can continue the remaining concepts. So first concept should be some laws we can discuss. Note down Stark law. Stark law related. So Stark law, what is the use of Stark law means? Stark law will prohibit the physician self-referrals. Stark law will prevent physician self-referrals. Here see, Stark law is set to United States federal law that prohibit physician self-referrals, especially a referral by a physician or a Medicare or Medicaid patient to entity for the provision designation health services. Okay, what is the physician self-referral? How the patient will get self-referrals from the patients? How they will do self-referral from patients? How they get more money like their refer self-referrals made? How they will referral? No? Suppose if the one patient maintaining pharmacy, they will send the patient to their own pharmacy. Or if any patient or patient relatives, if they maintaining diagnostic test center like lab test or diagnostic study center, they will refer the patient to the particular diagnostic center. Okay. Or PTO, physiotherapy or occupational therapy visits. Or some patients will work some days in one hospital and remaining days they will work on their own hospital. Whenever they go to the other hospital, from there they motivate the patient to visit their own hospitals. This all should be considered as self-referrals. Suppose one patient have one hospital and he also working as the endocrinologist or some consultant in another hospital. When they go to the consultation, they refer the patients from their own hospital for that patients. These also violations. Okay. This will prohibit by Stark law. Stark law will prohibit the physician self-referrals. Clear? Any doubt? Physician self-referrals?
Clear.
Yes. Next law, anti-kickback law. Anti-kickback law or anti-kickback statute. It also a federal law. Anti-kickback law prohibit financial payment or incentive for referring patients or generating federal healthcare business. So, if anyone referring the patients, if they are getting any valuable gift or payment from the physician, it also a violation. Okay, or generating healthcare business for the payment or incentive purpose or money purpose, it also a violation. So we should not refer any patients to the particular hospital for the money or incentive or valuable gifts. It also a violation. Okay. This anti-kickback law will prohibit this financial payments or incentives for referring patients or generating healthcare business. How they will do? Tell me. How they will do this type of fraud? How they will generate the healthcare business to offering the money? Please reply. No, no one. Okay, no issues. Anti-kickback law clear. So it will be prohibit the financial payments or incentives for referring the patient or generating federal health care business. Anti-kickback statute or anti-kickback law. Next, advance beneficiary notice. Advance beneficiary notice. Advance beneficiary notice is a form. Okay. Advance beneficiary notice is a form. Okay. What are the services not covered under Medicare? For non-covered services, if they performed before going to the service, the patient need to sign in the advance beneficiary notice form. They need to accept this service was not covered under the insurance. I am ready to the pay. So not only sign, we need to pay for that service individually. What are the services not covered under insurance? They will ask to sign in the advance beneficiary notice form before going to the service. Okay, we need to take service and we need to pay for that. That should be advance beneficiary notice. So Stark law, anti-kickback statute and advance beneficiary notice clear, right?
Yes.
Next, do note
Yes.
down
Excuse me.
softwares. Yeah, tell me.
Once again, tell me about ABM, Advanced Benefit.
What are the services not covered under insurance? If you go for the treatment for the particular service, before going to the service, we need to accept this service was not covered under insurance. I am ready to pay. That form should be APN. We need to
Okay,
accept that terms and conditions. We need to sign and we need to pay for that service.
okay, sir.
Okay.
Thank you.
Why? Because if you are not signing, some patients will ask, no, this why before why you are not informing to me this service not covered like that. That's why they are giving the instructions before itself. Next, softwares in medical code. What are the softwares we have? So to lead a coding are useful for the medical coding. Based on that, you will get three software related. Two software, CAC software, grouper software already I covered, right? Next, encoding software. Yesterday itself I explained the grouper software related. Grouper software, what is the use of grouper software?
To
Yes.
analyze the coded data to
Uh,
determine the appropriate payment based on
so
APC or DRG value.
yes, correct. To analyze is the coded data for the appropriate payment classifications, either APC or DRG. Next, CAC software and encoding software related we can discuss now. So don't take negligence, guys. These concepts you will get 30 questions overall queries and complaints. Whoever done properly these concepts, easy to clear exam. If you are not reading, difficult. CAC means computer assisted coding. Okay, what is the meaning of computer assisted coding? Anybody working in CAC in this class here? What is the meaning of CAC software, computer assisted coding? So what happening now previously in the medical coding, you all are experienced guys only, no? while you are going with the documentation, you will get the document and separate tool to add the diagnosis and procedure codes. Now, they implemented the computer auto-assisted coding like AI, artificial intelligence, in the document. Okay, they created a language how we are reading. The software also will read the entire document and it will identify the diagnosis and procedures from the document and it will code. It should be CAC, computer auto suggested coding. Automatically computer will code the document. Okay. So what language they used in this software? No? NLP. Okay. They use the NLP language, natural language. How CAC software assisted? No? So computers auto assisted coding used natural language processing and machine learning. So which language tool they are using in the CAC? Natural language processing. Here one question we will get. What is the tool they used in the CAC language? Language should be. What language used in the CAC tool? NLP. Natural language processing. Okay. But computer can give 100% accuracy.
No.
Not possible, right? So if the computer coding, it was not giving 100% accuracy. Okay, it will suggest all the codes 80 to 90% or 70% accuracy. Okay, but remaining 30 to 20% we need to do manually. Like we need to review the document and coders need to add. So who are working in this auto suggested process like CAC coding, who are working in the CAC coding, who are doing in the job in the CAC coding, they are doing validation process, not coding process. Who are working in the CAC, we need to do validation process. Okay, not coding, just validating. So how it will be now? CAC software will suggest all the diagnosis and procedures based on the document. It will not code automatically. It will suggest us all the procedures, diagnosis along with code description and highlight in the documentation. Just we need to cross verify based on our specific project guidelines and combination codes and code first sequencing rules we need to follow and we need to select the codable diagnosis as per CAC suggested. After, we need to review the document. CAC missed any diagnosis, we need to add ourselves. That is the process now going in the medical coding. Clear?
Yes.
Yes, no? So now, if CAC suggested any unspecified codes are missing the combinations, we need to look for that combinations and we need to code as per the documentation highest specificity. As per the documentation highest specificity we need to code. Okay, what? We need to code as per the documentation highest specificity. Suppose CAC suggested diabetes and neuropathy separately E119G62. Now, but we know that combination code we need to code. So you will go with as per CAC or as per the specificity.
As per the
Specificity.
So you will get question like CAC suggested unspecified diagnosis and document have more specificity. How you will code? We need to go with as per the documentation and we need to go with highest specificity as per the documentation. Do not select by default CAC auto suggested codes. All codes we need to cross check and we need to validate that code should be acceptable or not. That procedure should be acceptable or not. All codes and procedures we need to validate and we need to select. If any diagnosis or procedure missed by CAC, we need to code manually. Okay. Now, if CAC you are using in the medical coding, what is the benefit, uses? Tell me. What is the uses you will get if you're using computer to assisted coding?
Documentation review easily.
Yeah, documentation review, not easy. How it will be easy
Fastly, I think.
documentation review? Documentation we need to review every time, no?
It will suggest us to code the conditions, like to not to miss any condition.
So then what use you will get for a coder?
Easily get the secondary goods.
You will
We
get
can
This will
we can
save the
process the
time.
chart
Will save the
easily
get
time
in
and
this
complete
improve
time.
process.
accuracy. You will get good accuracy, not secondary diagnosis, not first diagnosis. You will get
It will
good
save the time and it
quality.
will improve the quality.
You will get good quality, like accuracy
Yes.
and productivity also will increase.
Also, it will save the time also while coding.
Who will leave you before 8 hours in your office? Anyone leaving you within 5 hours?
But we can process more charts in this that time.
That was productivity, not time consuming. It was increase the productivity. Okay, increase the productivity and accuracy. Disadvantage should be decrease the manpower. It was not time consuming, guys. They will decrease the manpower. If who are working, three people work, if they are doing two members, they will remove one person automatically, correct? They won't sit idle and they won't pay no, any organization. Correct? Huh?
Yes.
Yes. If three members working, they doing, they won't reduce your time. Okay, all people work 6 hours and you can leave. No one tell. Everybody need to work their shift hours. If they need, they will ask to do 1 hour extra, but no one will leave you before 1 hour. Okay, so they will decrease the manpower and increase the productivity. Charts coded per day they will increase for the medical coders. Seriously, guys, who are working the before not implementing the CAC for the same process, they after implementation of CAC software for the particular process, they increased 30% of the productivity. 30% of the productivity increased. Who are working in the CAC might be they know this and all. Who work the same process before CAC and after the CAC, still they know this process. 30% productivity they increased. Okay, suppose previously the same project they are doing 100 charts per day, now they are doing 130 charts per day. Okay, 30% of the productivity they increased means for every 4 members, one person lose the job. So decrease the manpower. They not required one person. So decrease the manpower, increase the productivity, increase the accuracy, which means quality. How it will be? Huh? If the CAC automatically suggested 80 to 90% of the score quality, just for remaining 5 to 10%, we can easily review the documentation. Correct? Huh?
Yes.
So increase the productivity and accuracy, decrease the manpower. This is the use. And language used in the CAC software should be NLP. Okay, and along with code you will get the code description data while suggesting code and code description data both you will get. So you can read the code description data and cross check in the document. It was easy, time saving. Okay, if suggested only code means again you need to search what is the code description data, but along with code it was suggesting code description data means simply we can cross check the documentation that code description data matching or not in the documentation. Simple. Any doubt in the CAC software?
No.
Here you will get 2 or 3 questions. Concept should be what language used in the CAC software? NLP. Okay, CAC suggested unspecified condition. Document have highest specificity. How you will code. Uh, What is the impact on medical coder by the CAC software? The impact should be increase the productivity, charts per day, and decrease the manpower. Okay, increase the charts coded per day, they will increase. Okay, that is the impact. Clear, CAC software?
Yes, sir.
Then next software should be encoding, guys. Anybody using encoder software to lead the codes here?
Yes, sir.
Encoder was a coding software tool, okay? It was not auto-suggested coding and all, it was coding software tool. So guys, who are working, while in exam, we are just practicing the book reading. While you are in work, real-time work, no need to use the books. We have softwares to lead the codes. Okay, ICD, CPT, PCS. We have the software tools like encoder, epic, 3M, different types of software tools we have. Based on the software tool, we can lead any code like alphabetic index wise, tabular list wise, keyword search wise, or directly if you enter the code, it will suggest the remaining code letters. So various methods we can use, and we can lead the medical code for the billing purpose. Okay. Encoder also a software tool to lead the medical codes to convert for the billing purpose. Okay, it was not any auto-suggested coding, it was just software leading. Okay, what? Encoder was the software tool. Yeah, it was not coming here, leave it. Encoder was a coding software to lead the ICD, CPT, PCS codes. Okay, like alphabetic index wise or tabular list wise. If you add any keyword search or code search wise, anything it will suggest. These two are the softwares. Grouper software already we discussed. Okay. So CAC software and encoding software clear?
Yes, sir.
Thank you. Next we can discuss regulatory complaints related first concept. Ensure completeness and accuracy of health records. Ensure completeness and accuracy of health record. Which means while we are coding, what are the document we need for the coding? What is the complete documentation? When we need to code the complete documentation, that and all we can discuss. Health record related completeness and accuracy. First concept should be the joint commission. TJC. These two documents I shared with you guys. Doc scanner heading. Doc scanner May 29. Doc scanner May 29. Heading should be domain 4 and 5 regulatory complaints. Information technology. Whoever read these concepts, then easy to clear. Okay. Don't tell me I don't have time, I am doing work. Everybody doing work. At least you will get half an hour time daily. If you don't have time, you can extend half an hour and prepare. Clear? So,
Okay.
because don't tell me at the ending, I don't prepare anything, can I pass exam? Without preparation, no one will pass. And don't tell me I am fearing, can you help me? Like that, don't text me. If you are texting like that, what can I do if you are fear? Whenever you are perfect for the exam, then only book. After booking, don't text me, I am fearing, I am worried, like that. I can't do anything now if you fear means. Okay. So while you are getting confidence, then plan the exams. So first concept, TJC, the Joint Commission. See, this Joint Commission establishes comprehensive standards for health record documentation. Some standards they set for the health record documentation. What are the things we need for the health record while we are going to coding. What is the complete documentation? What are the things they need to mention in the record? It was provided. The standards require the health record contains sufficient information to identify patient, support to diagnosis, justify treatments, which means diagnosis related treatment, document course and results, facilitate continuity of care. Okay, these all we need to check. So, what are the things you need to check in the document? These are the things. Patient identification information like patient name, number, then significant medical history, okay, HNP, diagnostic and therapeutic orders, clinical observation, diagnostic test results, consultations, procedures, diagnosis and conditions, conclusion at treatment of hospitalization, discharge summary, okay, discharge summary or discharge data they need to provide. All these things they need to provide in the documentation while they are creating. These standards, at least they need to provide for the coding. Okay. The Joint Commission will set the some standards for the healthcare record. What is the complete documentation? You will see this all the things in your document right while you are coding.
Yes.
Yes, no, we are seeing all the things. First, we need to check the patient name, software tool, and to document it was matching or not. Okay, any patient name mismatch, everything we can check. No? Next, Center for Medicare and Medicaid Services, CMS. Okay. Center for Medicare and Medicaid Services. It was provided like establishes condition of participation that healthcare facilities must meet for Medicare participation. Okay, what are the things they need? A complete darkness, like record must be completed within 30 days of discharge. We need to complete, and all entries must be legible and authenticated, which means signatures, handwritten or electronic signature. Without signature, if we code also, we need to put pending or we need to raise some flag. Electronic signature missing like that. Correct? We need to check the sign also. Correct? Every document.
Yes, sir.
Then records must contain appropriate identification information, means numbers, okay, patient numbers and all. Then documentation must be support medical necessity for services, which means yesterday only I discussed explain. No? If they done any procedure, we need medical necessity for each service. Without medical necessity, the procedure or service will not get the bill. Okay, for not meeting the medical necessity, they don't pay for that services. For every service, medical necessity compulsory need. Next, facility specific filing not required. Note down this concept. That's timeline standards. What is the time frame to complete every document? Here you will get two questions in this concept. So, establish expectations for when documentation should be completed relative to the patient encounter. Regulatory and accreditation requirements may typically establish maximum time frame for documentation completion. So, first concept only will get the question history and physical examination. Okay. History and physical examination time frame. In this related, you will get two questions. Yesterday also we seen HNP they given last month in outpatient document. HNP must be completed. ఇది note చేసుకోండి first 3 lines. When a history and physical is completed within 30 days to 30 days prior to inpatient admission, which means in outpatient we need to complete it within 30 days. From last 1 month we can take the HNP. We can complete also, no problem. It was valid. Or register after admission. after the physically admission within 24 hours, that also prior to surgery. Before going to any surgery, ambulatory surgery, okay, any surgery, before going to any surgery, what is the minimum documentation they need? Na? History and physical, patient history and physical status compulsory they need, because patient have any diabetic complication or hypertension or any surgical complication related to the particular procedure. The patient history compulsory they need before going to surgery, or physical status, current status also. That compulsory. So HNP time frame should be prior to admission 30 days. After admission, within 24 hours, before surgery. Before surgery. Note down here one question you will get. What is the time frame to collect the HNP after admission? They will give option like 24 hours, 48 hours, 72 hours, 30 days. What is the answer?
30 days.
After the admission.
24 hours.
24 hours.
Within
24
Hours
hours.
after admission.
Clear. So next time frames also note down. Outpatient operative report immediately after surgery, discharge summary within 30 days, progress note contemporaneous with care, consultation report within 24 hours, 24 to 48 hours. The consultation report within 24 hours or to 48 hours of consultation. Progress note contemporaneous with care means immediately after care. Okay, discharge summary we need to complete within 30 days of discharge. HNP must be completed within 24 hours after admission, before admission, 30 days. Okay, the timeline standards related you will get question, and the Joint Commission Act related you will get the question. Then this medical necessity, you know, right? Yes or no, guys? Medical necessity, you people know, right?
Yes.
Next note down fraud and abuse in medical code. Abuse in medical billing. What is the meaning of fraud? What is the meaning of fraud and abuse?
మోసం సార్.
Mosam. Then abuse means
Violation rules.
Intentionally, knowingly.
wantedly if they done anything like super making the super bills. Okay, it should be fraud. If by mistakenly happen, it should be abuse. Okay, by mistakenly happen, abuse. If they done wantedly making the super bills, it should be fraud. So how they will do fraud in medical billing? No, they will do upcoding. Okay, if they done one level of service, they will do Suppose they done the level 3 service, but they will pay at level 4 upcoding or diagnosis extra adding. Then phantom billing means they will bill for the service whenever they never performed the service. Okay, what service they never performed, but for the same service they will bill. Another common billing fraud should be phantom billing. Refer to billing for service that were never performed. Okay, they never performed service also they will do. Then this kinetic encoding and all self-referral, Stark law, and cloning. Cloning also another common error. Cloning means EHR document like electronic health records from one patient are copied to automatically generate other patient records where the symptoms have been similar to create elevated bills. Okay, they will take one patient record and they will create for the another patient what are the same symptoms here, and they will create a bills. It was a cloning. Cloning also error. Okay, upcoding, cloning, phantom billing. If they're done wantedly, knowingly, it should be fraud. If they're done by mistakenly, like medical coders we are doing no errors, it should be abuse. Okay. Next note down cloning means
Coding without medical necessity can also be fraud or as well as abuse. No?
if
They done
that if you
intentionally.
by mistakenly you done, you don't know. Okay, it should be abuse. If you know but still you done, it should be fraud.
Okay.
Okay. So wantedly you done fraud, mistakenly happened abuse. Next note down the cloning. Here you will get one question. Cloning also another common error. No? What is the meaning of cloning? No? Copy paste also known as cloning. Copy paste. That highlighted blue line, first 4 lines, please read. Then you will understand.
In
So,
some cases, they will copy and paste the same HNP of a patient from a progress note to another progress note. No, then it is
hmm.
also a cloning.
No, it was actually copy paste was acceptable. Okay. We can copy and paste the all progress note or HNP dot. It was permissible. But we need to edit for the another progress note. Okay. You got my point?
Yes.
Okay. You copy paste should be permissible, but we need to change the document variation. Suppose progress note 1, you get one documentation. For the progress note also taken the copy paste, but you are not changing anything. You are getting all the progress notes same verbiage. It was issue, right?
Like they should change some lab values or something like that.
At least if they're done every day, na, they need to find some different lab value or any one symptom change or diagnosis added. Okay. Without changing anything, you are getting all the progress note or all the consultation, same verbiage. That it should be issue, right?
Yeah.
Yes, it was a cloning issue. Cloning should be permissible. Copy paste should be allowed in the EHR documentation, but we need to edit for the next progress note or next document. Okay, if you are not editing, if you are getting same verbiage or identical verbiage in all the progress note, what is the issue in that? No, it should be a cloning issue.
Okay.
Okay.
Got it now.
In that concept, you will get one question, guys. Patient identify all the progress notes on same verbiage. What is this issue indicates? This issue indicates
No.
cloning.
Cloning.
Cloning, copy, paste. Okay. Cloning, copy, paste. It indicates. Clear? Thank you, guys. These all are theory concepts you need to read. There is no other option. Copy paste also important. One question you will get. Then payer specific NCD I explained, right? National coverage determination yesterday. Local coverage determination. Like here they will give list specifying which diagnosis code support medical necessity for particular procedure. They will provide the list for each procedure. What is the diagnosis covered for the particular procedure? Okay. Then MUE also I explained, right? Medically unlikely edits. Maximum unit of services. One one procedure. How many times we can code per day?
Yes.
Simple. If you add MUE edits in the Google, no, you will get the two tracker. In exam, they won't ask the value for procedure. They will ask the definition of MUE edits. Okay, this is the edit. MUE value assigned to a CPT or SCPCS code indicates the maximum unit of services for single beneficiary on a single date of services. Suppose it was updated every quarterly. If we add any procedure, it showed MUE value. 2 means if they done the same particular procedure 10 times in a day, we need to code only 2 times. Based on the MUE value, we need to code. Okay. Any procedure we can search. Based on the MUE value, we can code. 8 means maximum 8 times we can code. More than that, no need to code. It won't be built. Clear?
Yes, no.
Then this MSDRG.
Sir, I want to ask one question.
Mhm.
If we see any CPT in encoder that show 2 and 3 MUE just like that, that
It
means
means that code should be maximum allowed 2 or 3 times per the day.
true. In first column there is a 2 and in next column there shows 3.
Whatever it showed, 2 means that procedure we can code 2 times.
2
3
times.
means that procedure have 3 times allowable.
Okay.
MUV value 3 means that procedure maximum we can code 3 times per the day.
Okay, sir.
Software automatically suggests everything. NCCA edits, MUE edits automatically pop up. If you are adding any bundling procedures, automatically it will pop up. Okay. What tool will help to these pop-ups na? Medicare code editor. Okay, Medicode code editor. You will get one software tool automatically it will suggest all the edits based on this Medicare code editor in the while working. We no need to check this MUV and CD all automatically it will pop up. Then not required. Modifier says medical necessity. PSI HAC also I explained for previous class. For remaining I will explain. POA also I explained for some people. Remaining people I will explain in coming classes. Next, note down HIPAA compliance for coders. HIPAA compliance, HIPAA Act. Here you will get 2 to 3 questions from HIPAA itself. So what is the mean? In your offices also regularly they will conduct the HIPAA related exams, no? Compliance related.
Yes.
Yes, sir.
In every office, they will conduct HIPAA-related compliance exam monthly or quarterly or whenever newly joining or any process project where before going to start, it will give the compliance test. So HIPAA, Health Insurance, Portability and Accountability Act. Okay, when the HIPAA was established in 1996. Note down this year, 1996, HIPAA was established as a law. So HIPAA established national standards for protecting sensitive patient health information. Okay, this act will help to the protect of patient sensitive information, which means health information. Patient health information will protect based on the HIPAA. HIPAA was useful for the protecting the health information because while we are working, you will get all the patient data, name, address, and age, what are the diseases patient have, everything. So we should not violate and we should not disclose outside what are the diagnosis, what are the things patient have. So if we should violate, it should be a violation. Based on the violation, they will penalty the for that particular person or organization or office physician. All the entities will covered under HIPAA. Covered entities like organizations, insurance companies, and third-party payers, and individually coders. Everyone will covered under HIPAA rules. Okay, but separate HIPAA rules have depends on the person wise and organization wise. What are the things organization need to protect? What are the things coder need to protect? We have different rules. So if you violate anything, they will do some penalties. What is the violations? How you will get the violations? Tell me in HIPAA. Some violations tell me in HIPAA.
Discussing the patient information with others.
Demography.
Take a pic.
If you are discussing the patient information in others in public places or outside, or if you're posting in the social media about the patient details, okay, these all are violations, correct? Okay, so here two questions you will get related to HIPAA violation. They will ask the question, they will give four options, and they will ask which of the following option is a HIPAA violation. Okay, can see the options and which option was misleading the patient details, that should be a violation. You will get two questions. That answers also note down. HIV result, HIV test results discussed with patient in waiting room. It was violation or not? HIV result discussed with patient in waiting room.
Violation.
Violation.
It's
We should
violation.
not discuss the HIV result in public places. Waiting room means lot of people will sitting, right? So we should not disclose the patient details in waiting room or public places. Next, a nurses discussing about the patient condition in the hospital lobby during lunchtime. Here, nurses only discussing the patient condition, but where they are discussing in the hospital lobby during lunchtime, it was violation or not?
Yes, sir.
Violation.
It also violation because lunchtime and lobby means lot of people will sitting. We should not disclosing about the patient in the public places. Clear? So we need to protect the health information. These two questions we will get from violation type. So note down. Okay, what? Next, we have certain rules based on the HIPAA, like privacy rule, security rule, like that. So first rule should be privacy rule. Privacy rule. Here one question you will get, guys, from privacy rule. Okay, which rule restricts the patient data without disclosing the patient details? So privacy rule establishes national standards for protecting individually identifiable health information. Like patient or person health information, it will protect. Individually identifiable means person to person. Each person health information, it will protect. So HIPAA rule, privacy rule establishes national standards for protecting individually identifiable health information. Here, one question you will get: which rule restricts the disclosing the patient details? Which rule will restrict without disclosing the patient details?
Privacy.
Privacy rule. Okay, privacy rule will restricts to disclose the patient details. We should not disclose anywhere. Okay, privacy rule will protect the patient individual health information. So here they given the rules how we need to protect the documentation. So go through these points. So coding professionals, how we need to protect. Okay, and work side, how they need to protect the health information. This the guidelines they given. So go through these all points once you can read. Done. Okay. Next, security rule. Security rule also will get question. Security rule. The security rule establishes standard for protecting electronic health information. Electronic EPHI, like documents. It will protect the documents. Electronic protected health information means while we are working the EHR document, electronic health records, it will protect the electronic health information. Okay, so in various levels, in administrative level, how we need to protect, physical level and technical, and coding professional, how we need to protect the health information. Okay, like password changing, automatic log off, and encrypted mails while we are sending any patient health information, restriction on remote access coding system, audit tiles tracking who accepted, and technical safeguards, physical safeguard, and administrative safeguards like risk analysis, workforce security, and physical safeguards such as facility access control, workstation control, like they give the access cards and all right, do not enter anyone, and technical safeguards like audit controls, access controls, and transmission security. Clear? Huh? This you can read. You will get the questions from the physical and technical safeguards related. So this violation comes under physical or technical or administrative side. They like that they will ask. Clear? Huh? Security rule. Any doubt, guys? Privacy rule or security rule? No, no. Then business associated rules, no need. Then these all are common thing, like social media awareness means what are the things we need to uh, post on the social media, what we should not post. Okay. This is how we need to code the documentation, like while we are coding, what are the things we need to check in the document, how we need to code the documentation. Everybody know, right, how you need to code. Like these all are the coding support. So coding only what is explicitly documented by a qualified provider. What they documented, that only we need to code, avoiding assumption about implied condition or procedure. We should not assume anything. Using established query process to clarify. While we are coding, if you have an issue, we need to query. Recognize the boundary between the interpretation and inference. Resisting pressure to code beyond what documentation support. These all are common things. Based on that, we can clear. These all are common points, guys. While we are coding, what are the things we need to follow in the record? These all are ethical record. How we need to review the documentation and all. So nothing much explaining here. Next, note down high tech and EHR documentation. Power set high tech. High tech means note down. Health Information Technology for Economic and Clinical Health Act. Health Information Technology for Economic and Clinical Act. Okay. So what is the use of high-tech law? Na? High-tech law was part of HIPAA, guys. High-tech also under part of HIPAA. Who establishes this high-tech now? ONC, Office of the National Coordinator, establishes the high-tech rule. This high-tech also work under the HIPAA. This high-tech will protect the electronic health information. EHR documents, electronic health records. While we are working, all records we are getting now under electronic health record format only, right? EHR format only, no? So we have previously some manual recording, like they will maintain all the patient data in the paper format. Now also we are taking the paper format, right, in our side. They will give all the file and they will take for every while you are going the hospital. You take your file, na? Yes or no?
Yes.
Manually, you will carry your data every time.
Yes.
So
Yes.
now, actually, they in USA they implemented EHR format. Like they will protect all the patient data in the electronic format. They will store in the electronic data. So what is the benefit whenever they store in electronic format patient data? What
Easy
benefit?
access.
Easy accessible whenever they need they can review, are easy to share for another patient when they need, they can ask directly to the particular patient to access easily, they can review the patient past medical history and it will not misleading, like if we cannot they cannot forget, right? If you are carrying the paperwork means after some days it was not difficult to maintain the file and all. In EHR you can store easily, so there is no misleading in the documentation and patient data. But in the comparing to manual, paperwork, EHR format, some disadvantage like it was easily hacked, correct? We can easily access to the EHR documents, right? Anyone easily access. Yes or no? If you easy to take that data. So for but high tech will protect and high tech will implement certain guidelines. How we need to follow the EHR document, how we need to protect the electronic health records and all. This high tech act will you help to protect. For the physicians, also it will give some rules and regulations. How you need to store the high EHR format, how you need to maintain the proper EHRs, and who are maintaining the proper EHRs. It will provide some incentive programs also to providers. Whoever provide the proper EHRs for the providers, it will provide some incentive programs also. This what does it do? No? High tech provide incentive for healthcare providers to adapt EHRs and standard for using them effectively. Like most properly who are using, they will provide some incentives. So this high-tech rule establishes for the proper usage, the meaningful use of EHR documents. How we need to use the proper EHR documents. Okay. Who enforce it? High-tech enforced by the CMS, Center for Medicare and Medicaid Services, and ONC, Office of the National Coordinate for Healthcare Information Technology. This question you will get, guys, in exam. Who establishes the high-tech rule? Who enforces? They won't give CMS, they will give ONC in the options. Office of the National Coordinator you will get. One question here you will get. One question you will get. What is the use of high tech? No? Meaningful use of EHR documentation. There also you will get one question. Clear? Adoption of EHR. It will provide some incentive and it will protect the EHR documentations. This is the high tech.